Hello friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with me is Dr. Gabriel Mapeso, who is a surgeon at Thunder Bay Regional Health Science Center in Thunder Bay, Ontario, Canada. Today we are going to talk about inflammatory bowel disease. Inflammatory bowel disease are the disorders in which a segment of gastrointestinal tract becomes inflamed and ulcerated. There are two main types of inflammatory bowel disease, ulcerative colitis and Crohn's disease. And they are very common in Canada and in the developed part of the world, including North America and Europe. It is estimated that 250,000 patients at this time are suffering from ulcerative colitis and Crohn's disease. And it is very common in Canada. The prevalence of this disease is increasing every day. There are about 5,900 children are affected with inflammatory bowel disease, and it is a lifelong disease which has impact on the personal life, the social life, and the economic life of the patients. It is estimated that in 2016, $3 billion was the economic impact of inflammatory bowel disease in Canada. So it is a very important disease which is very common in our part of the world, and today Dr. Mapeso is going to enlighten us with various causes of disease, various risk factors, various investigation methods and treatment options available at this time. Thank you, Dr. Mapeso, for coming to the show Talk with Your Doc.
Thank you for inviting me over as well.
Please share us about your experience with inflammatory bowel disease in terms of what are the causes of rising incidence of this disease of ulcerative colitis and Crohn's disease in Canada.
This is a very interesting disease because if you actually read any book about it or journals on it, they always start off with the point that the causes are unknown. However, there are a lot of risk factors that are associated and they think it may be the cause of it. So it could be diet, could be environmental, it could be an infection that has gone wrong, or it could be the bacterial flora in the body, which is the new thing now. Your bacterial flora in the gut may make up you, whether you are sickly or not. It all depends on that. And also they think it's something to do with the immune system going haywire in the body that attacks your bowel. So the one thing for sure, as you have mentioned, that it is more common in developed countries. It's very interesting because some people who come from countries where it is very rare, when they come here to North America, they seem to have an increased incidence for the same group of people.
Yes, I agree with you on that. I have seen that quite a few Asian families, when they come to Canada or North America, their children tends to get more of this inflammatory bowel disease than their parents who are coming from Asian countries.
Yes.
So is it related with diet and environmental factors as well?
Environment, they say, is a factor. Diet, they say, is a factor. But one thing for sure, the mechanism, whatever triggers it, the mechanism is something to do with the immune system. So the immune system starts to target the cells in the bowel and they become inflamed.
So, what happens to the patient? What are signs and symptoms of ulcerative colitis and Crohn's disease?
The symptoms can be minor. They can have mild abdominal pain, cramps. They have what they call, some people label irritable, your bowels are irritable, they get diarrhea. Then we go to more serious things like fistula, fever, severe abdominal pain, obstruction, and in some situation the infection is uncontrolled. You perforate the bowel too, that can also happen. And so you have mild to very severe. And the most important thing is if there is something wrong with your bowel, to have it checked so that to see if you have this disease or not.
So if somebody's family, say first group of member of family has ulcerative colitis or Crohn's disease, and they have all these symptoms of loose motions, bloody diarrhea and weight loss and all other pain in the abdomen, cramping, all these symptoms, what are the chances that the other members of family will get this disease?
Well, you are considered high risk, but not necessarily you will get the disease. But you're certainly at more risk than others if you have a strong family history of ulcerative colitis. So I agree with you, hereditary and genetic factors is a factor, but not everyone in the family will get ulcerative colitis. So there is some triggering mechanism, and that's what they're trying to find out, what triggers the inflammation. So you are at higher risk if you have them. So if you have any symptoms and there are relatives that you have them, then you should be investigated for it.
So now, how does this ulcerative colitis and Crohn's disease affect our day-to-day life?
Oh, it is very devastating for some people. And like you say, you mentioned very well that it is a very costly disease, because for some people it interferes with their lifestyle, and they get admitted to the hospital, and some of them become totally disabled. And we've had patients who are in the hospital for many weeks and sometimes months who have complications from the disease. So it is very devastating. Or they have people who get minor attacks here and now, or major attacks, and then they get better, then they come back again to the hospital, they get admitted, IV antibiotics, excluding, I'm not even talking about the surgery. Some people have the surgery, and then that's also another cost to the healthcare or to society as well, because it is very devastating.
Right. So patients with ulcerative colitis and Crohn's, they have to go to the washroom very repeatedly. So their career choices might also get limited, right?
Correct. It affects their work environment. They have to be off work for that. And also, some people actually consider themselves cannot return to the force because of their disability. So
they have to go use frequent washrooms, and that accessibility, the personal lifestyle also gets affected.
Gets affected.
Relationships get affected.
That is true. And can you imagine if you're in a board? I remember a patient very well when he had inflammatory bowel disease. He could not, and he was a very good executive worker in a company, but he could not stand in the meeting, because if the meeting goes more than 30 minutes or an hour, he has to go to the washroom, and then he has to clean himself and come back. And he just could not. And then when he is a salesman too, I also know about a salesman. Can you imagine talking to your your customer, and then you really want to go to the washroom or else you're going to have diarrhea. Yeah. So it is the impact is very devastating.
And one cannot travel also, right? If
one cannot travel as well. And can you imagine traveling and then you want to go to the washroom? In fact, you have a very good point. Another patient of mine, he said he was very thankful when he finally had an operation and he had a bag. This is one of the few patients who admires to have a bag, because now he says, I can drive, I can sit in a meeting, and even if the poop comes out on a colostomy or ostomy bag, he finds it very, very convenient rather than running to the washroom.
So we can see that ulcerative colitis and Crohn's disease are very debilitating diseases.
It can be, yes.
It affects the personal life, the social life, and the economic life as well of the person. Yeah. So how can we diagnose it at an earlier stage?
The diagnosis usually they occur commonly in people who are younger, usually in their 20s or 30s, and then there's a gap where there's not much incidence of it. Then it comes back at around 50 and 60. There are a few people who will get it around 50, 60 years old or a bit older. So again, the symptoms are typical, generally diarrhea and going frequent to the washroom, including bloody diarrhea. And in worst case scenario, you will have your very first episode, maybe a major abdominal pain, obstruction, bloody diarrhea, and that might be when you are diagnosed to have it.
So those are early signs and symptoms.
Those are early signs and symptoms. And so the more severe the disease, of course, the more severe the symptom.
Thank you, Dr. Mapeso. We'll take a short break and we'll come back and talk more about inflammatory bowel disease and know about it from Dr. Mapeso. Thank you.
Thank you.
Welcome back to the show, Talk with Your Doc. And with me is Dr. Gabriel Mapeso, who is a surgeon at Thunder Bay Regional Health Science Center. Dr. Mapeso, you were mentioning about small children can also get affected with the ulcerative colitis and Crohn's disease. So what age does it start?
I've seen them as early as less than 10 years old, and they can be very devastating because the growth of the child or the children are stunted. They have malnutrition, and they have severe malabsorption as well. and nutritional abnormalities. So it can affect young children under growth as well.
So 10 years of child being affected with this inflammatory bowel disease, what happens to their life further? So it remains lifelong, or?
Yes, and this is what a lot of people do not really expect or understand about inflammatory bowel disease, because once you have it in general, you have the disease, the treatment, so-called treatment we have are things that control it, but it doesn't actually cure the disease, unfortunately. There's still a lot of research going on about curing inflammatory bowel disease, but it's actually managing or treating the symptoms so that it's not as bad.
Right. So there are two main types of inflammatory bowel disease, ulcerative colitis and Crohn's disease. Can you please tell us some differences in the clinical signs and symptoms?
Yes, in the Crohn's, it's a very interesting disease. Both of them are. In the Crohn's, it affects what we call bowel. They separate into bowel symptoms, and the other one is what we call extra-intestinal manifestations. So it can involve, your skin rashes, you have abnormal skin rash on your leg, you have ulcers or sore sometimes, or you have joint, you have arthritis, or you can have, they call hemorrhoids, problematic hemorrhoids that doesn't heal, rectal bleeding, you said you have a fissure that doesn't heal sometimes, and you may have mouth, and it affects, besides the bowel, it also affects the stomach. It can also affect the small bowel, the large bowel, and it can affect the mouth as well, up to and the esophagus. So
that's about
Crohn's. Crohn's disease. The ulcerative colitis is very specific. It's usually in the lining of the large bowel. So the lining of the large bowel is affected by it, and you can have diarrhea as well. You can have bloody diarrhea, is more prominent with ulcerative colitis, and then it's potentially curable, because if you take out the large bowel, then you're free of the disease.
Okay. Now, how do we diagnose it? By various investigations, the ulcerative colitis and Crohn's, or what do we do to diagnose and differentiate them?
When you go to a specialist and have it done, they do a lot of tests, investigation, but one of the most important things that they do, including Dr. Jani is a pathologist, is we take biopsies of the lining of the bowel, and then the biopsies will determine what kind of type it is. Having said that, there are, unfortunately, there are signs that is very indicative of Crohn's, and then very indicative of ulcerative colitis, and there's some people who will fall into the indeterminate type, and that is a challenge as to find, because you have to watch the progress of the disease and repeat the biopsies. But in general, you can separate the two, and if you have one or the other, then you can be treated accordingly to the type you have.
In addition to the biopsy, which is the diagnostic procedure, what other investigation, any radiological investigations needed to diagnose this?
Correct. You are correct. You can do imaging studies or blood tests as well, inflammation. There's such a thing as markers for inflammation in the blood, CRP, erythrocyte sedimentation rate, ESR, your blood test, white count, platelet count, all of those things. And there are certain imaging studies like X-ray, and you swallow the dye and they can see the dye, how the bowels are abnormally formed, and the part of the bowel that are affected, whether it is the colon or the small bowel, and then fistulas, which would be more, fistulas would be more for Crohn's rather than ulcerative colitis. So then CAT scan and MRI for complicated cases.
So all radiological and pathological investigations will help us to differentiate ulcerative colitis and Crohn's disease. Then is the treatment different for both the disease, or the treatment is the same?
The treatment is the same to some degree medically, but surgically you have to take a lot of things into consideration, because in Crohn's you treat it, and ulcerative colitis you can give anti-inflammatories, and there are different stepwise grade. There's a step 1, if you are not responsive to the first group of medication, they go to the second group, and then the third groups, which are very expensive, and the biologics we call it. So It's a stepwise progressive treatment. It depends on your symptoms, how you are controlled, including steroids. Okay. Steroids can be given for both as well. But there are certain medications that may be more effective to Crohn's than ulcerative colitis. So basically, we have to divide our medical treatment by medical treatment, lifestyle changes, dietary changes, and then the surgical treatment, which is now a bit more complicated.
Right. So once a patient is diagnosed and he is first put on the medications, which might include anti-inflammatory medication and steroids or antibiotics, along with that, what sort of dietary changes required?
Well, they recommend milk, void milk products is the one. And some people say that if you take some yogurt or bacteria as well, the good bacteria, lactobacillus as well, trying to change the flora of your gut is one they say is another option besides that. And in general, processed food are generally not very well tolerated.
What do you mean by processed food?
That's a big, I would say, contentious or issue, because in the processed food, there are so many things that are added to it. And this is where the controversy arises, because we generally process our food and there's just so many things in it. Then we modify genetically modified food as well. So we don't have as much natural food, so to speak. And our diet tends to be more on fat, tends to be more on sugar, tends to be more on carbohydrates, which I think some people say that may aggravate inflammatory bowel disease as well.
Low carbohydrate, low fat, low sugar diet.
Yeah.
Does low meat diet and more green diet will help?
It does to some degree, they say, because there are certain grains that are bad and there are certain grains that are good. I don't have a list right now, but there are websites that are very indicative of what are the good vegetable, so to speak, and the bad vegetables.
Okay. Yeah. So once is medication, then the dietary changes as you recommended. What are the lifestyle changes needed?
The lifestyle changes is, of course, I think if you're active, exercise as well, and again the diet. I think most of that. And
does smoking reduction helps?
Yes, smoking reduction helps. The smoking reduction helps more on ulcerative colitis than on Crohn's. The smoking is not so effective if you reduce it in ulcerative colitis, I think. And there may be some, there's a study that refers that smoking may actually suppress in ulcerative colitis, but not Crohn's.
Okay. Yeah. So smoking reduction is definitely useful to reduce the signs and symptoms of ulcerative colitis and Crohn's disease.
Alcohol as well.
Alcohol reduction is also very important. Great. Thank you, Dr. Mapeso. We'll take a short break and we'll come back and talk more about the ulcerative colitis and Crohn's disease. Please stay back. Welcome back to the show Talk with Your Doc. With me is Dr. Gabriel Mapeso, who is a surgeon at Thunder Bay Regional Health Science Center, and we are talking about ulcerative colitis and Crohn's disease. Dr. Mapeso, we were talking about various investigations and various treatment options, which included the medical line of treatment, the dietary changes, the lifestyle changes. One of the factors which you were mentioning about the food, and you were mentioning about pesticide use. Can you please tell us about it?
Yes, apparently almost every food that that's when I mentioned the processed food, because there are antibiotics, there are pesticides, and it has been sort of indirectly blamed, and it's very difficult to put a direct evidence to it. It's controversial, but there is some strength in the argument that we are doing harm to ourselves by using a lot of these pesticides, antibiotics, and modifying our food. And so, hence the rise of some of these diseases.
So organic food is better than the pesticide?
Definitely organic food is better than that one. And in fact, if I remember right, when I just came back from the Philippines and I was, they were cooking chicken soup back home in my house, and I was surprised because sort of I haven't gotten used to it because there was literally no fat. Like the soup had no fat at all. You had the skin, but no fat. But in here, it's very fatty.
Right.
And because of the whatever they do, growth hormones and whatever they add to make the meat.
So if patient
fatty.
is not being controlled with the medicine or lifestyle or dietary changes, or if the disease remains for a very, very long time and it is affecting the life of the patient, is the surgery a choice?
The surgery is definitely a choice once you have arrived at the conclusion, usually for a few reasons. One of the reasons is failed medical treatment. If the medical treatment doesn't control the disease, dietary changes or lifestyle changes, whatever, and you have also gone to the third line of treatment, then surgery then has to be considered. Surgery is not taken lightly because it can be life-changing as well. You might end up with a stoma. You will have a major bowel resection. If there are fistulas, depends on the segment of the bowel involved. It may be there may not be so much change in your bowel habits. Depends on the extent of surgery.
So a young patient who has to resect a segment of the bowel or the intestine has to be removed, what happens to him for his lifestyle then?
Well, in general, if you resect less than a third of the small bowel is more important for life than the large bowel. You can live without your large bowel. That's not to say it's not important, but it is important for us to function well. But the small bowel we need the small bowel. So if you resect less than a third, usually you can absorb the nutrients. But if you resect like a third, a half, then it starts to affect your nutrition. If you resect and leave a third and you resect 2/3, you have a problem with malnutrition.
Okay. So if more amount of small bowel is removed, it is more worrisome for the health.
Yes, correct.
So for those patients whose segment of small or large bowel has been removed, do they have to carry the bag always, or what happens to them?
There are ways to sort of recreate continence, especially if you lose your rectum or the large bowel and the rectum, and they try to make a pouch, we call it. So a lot of people refer to the pouch. Can I have a pouch? So a pouch is a way to make a reservoir so that your bowel will stay, or you will stay continent and has a reservoir for the stools before it comes out. Now that can be a bag, a reservoir in the skin here as a bag, which you don't have to empty as often, but more preferably for younger people, they would prefer to have the normal continence. And so it's a pouch between the anus, and they recreate the small bowel that is not affected into a kind of a bag. Okay. So they call it a pouch.
Right. Now, so after the surgery, how is the lifestyle? Is it like normal, or are the patients feeling better, or what happens to them?
It all depends on what they have. So if they have the pouch, then they will be almost as normal, although they may be going to the washroom frequently, but they don't have the disease. It's a question of the capacity of the pouch. Now, if they have a stoma bag, it all depends. The one aspect that we haven't actually talked a lot is that a lot of these people, because of the chronicity of the problem, they do have it has a psychological burden or stress on anybody because it is very debilitating. And so it all depends on your outlook. And some people have a very good outlook with their bag, and some people don't have it, they don't like it. So it all depends on your outlook of the treatment of the disease. And also you will now have a new lifestyle. If you have a bag, you have to learn how to take care of it. It is now your bag, and it is now your pouch.
So it remains there for lifelong. The bag is there for lifelong.
It is lifelong.
The patient who are treated with the surgery, are they increased risk for getting cancer of the colon?
It's very good you mentioned that one, because I think of all the things that you have mentioned, the most important from my surgical, my specialty as well, is that inflammatory bowel disease carries a risk of cancer. So if you, especially ulcerative colitis, if you have more than 10 years disease, 1% every year is the chance of you getting a cancer.
So
and that's the reason why we follow you up with colonoscopy and biopsies,
right,
to make sure that there's no changes in the lining that are going or heading into cancer.
So how often one should get colonoscopy done then?
The colonoscopy is usually done every few years, every 4 or 5 years, depending on the severity of the disease. Sometimes you follow it up every year. If you have the disease for more than 10 years, generally it's more frequent than every 5 years. So sometimes they do it even yearly for some people. And the biopsies are a lot. It is a lot of biopsies, because the recommended biopsies are several biopsies every few inches. So they take samples of the lining of the bowel, because it's very hard to detect the cancer grossly at the microscopic level. They have to detect it. So it is very, very important to talk to your doctor about the biopsy results to see if there are any risk or changes suggestive of cancer or heading towards it.
Are there any new treatments or alternative treatments available for the inflammatory bowel disease?
Yes, the newer treatment right now are the biologics. They are treating it. It's a very, very high, a very specific treatment for the immune system. And then there is some anecdotal treatments like changing your gut flora, fecal transplantation. Anecdotally, there are some people who get better with it, but it's the icky factor that people don't like it. But what it boils down to is that there is a good evidence that if you change your bacterial flora, meaning your diet has to change, the type of food that you eat, the type of chemicals, whatever that'll be that we're eating is harming us, it has to change.
I was reading an article which was mentioning that our so-called healthy lifestyle, when the children are very small, and we prevent them from so many infections by giving them hygienic food and hygienic items.
Yeah.
But those natural infections which children get during their childhood, that might boost their immunity to protect them against the ulcerative colitis and Crohn's disease probably.
Very good point. Our body, as we develop, needs what we call an immune challenge. So if our immunity is not challenged, then we don't develop the same way as we are vaccinated. So every infection we get, like a flu, we get immune to it because our body develops resistance. So if you are isolated totally, you will not be immune to almost anything.
So too much hygiene is not good.
Too much hygiene is not good. And I don't know now, I have to look back at it, because as a kid I was rolling on the ground, playing on the ground,
correct,
and crawling and doing whatever with the other kids. Were playing in the mud. Now, having said that, it's not a dirty canal, whatever, but we were playing in the ground and everything, and now we try to avoid kids from doing that. I think we're not developing their immune system very well.
Yeah. With that note, thank you, Dr. Mapeso, for coming and participating today in the Talk with Your Doc.
Well, thank you very much.
It was very helpful to know about the disease. Thank you so much.
More than glad to be
Thank you
here.
everyone for participating.